Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded? For example, somebody who might die from a number of factors but had coronavirus are being listed as coronavirus deaths, and because of that, the number is being inflated.
You know, having been through other serious issues, particularly the very painful early years of HIV, AIDS, when people talk about conspiracy theories, you will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions. You know, I can assure you we have so much to do to protect the health and the welfare of the American people that I would just hope we just put those conspiracy stuff and let somebody write a book about it later on, but not now.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
One of the things that concerns me also is I wish that Admiral Guar was here yet. I asked this question of him last time was here, and we didn't have enough time to continue our discussion on it with regards to the sort of perverse incentive for the medical folks to claim that somebody died of COVID versus if it's an automobile accident, for instance, as long as you have COVID in your system, you get to claim it as a COVID death, in which means you get to get more money as the attending physician, hospital, whatever. And he acknowledged that the statistics he's getting from the states are overinflated. We found that the governor of Colorado, who is a Democrat, actually did a research on this and found he had to get rid of 12% of the deaths that were recorded in state. Dr. Redfield, would you like to comment on that a little bit about the perverse incentive, and is there an effort to try and do something different in a way that these deaths are recorded so we actually have better records and better numbers, better data to go with?
Thank you, Congressman. I think you're correct in that we've seen this in other disease processes too. Early in the HIV epidemic, somebody may have a heart attack but also have HIV. The hospital would prefer the DRG for HIV because there's greater reimbursement. So I do think there's some reality to that.
There was a reporter on the line because of our conversation, and you know you were on the Laura Ingraham show last night, and you had alluded to maybe there were some financial purposes or financial reasons to inflate the COVID-19 deaths. She just said at the end of that conversation there that I played for our audience, there's no policy and no politics that would cause anyone to want to inflate those numbers. What say you?
I can't buy into that. I think we're going to have hospitals shut down and potentially never open their doors again. This is serious business. We might have the big metropolitan healthcare systems getting big chunks of money from the feds, but the bottom line is your outer ring hospitals and your hospitals out in Minnesota that aren't critical access, they're at risk. So I think that I would rather have people draw their own conclusions. Let me just say this. If I admit a patient to the hospital and they're on Medicare and they have just routine pneumonia for a diagnosis, the hospital will get a lump sum payment called a DRG, and it'll be about $4,600. If I admit that same patient and I attach COVID-19 to the pneumonia diagnosis, then it goes from $4,600 to $13,000 for that admission, regardless of whether the patient's in a hospital for 3 days or 13 days. If during that hospitalization I put the patient on a ventilator for a period of time, then the payment goes from $13,000 to $39,000. Now, that's a big payment.
Doctors who spoke with One American News explained that 131,000 patients who are being considered COVID-19 deaths already had life-ending diseases, including cancer, dementia, and even end-stage renal failure. And according to the CDC, again, if you look at place of death, you'll see that some 10,000 patients who died from COVID were on hospice care, meaning they were terminally ill to begin with and were already expected to die. Doctors tell One America News that all of these patients were critically ill and likely died from their pre-existing conditions without any help from the coronavirus. However, they explain that the CARES Act, passed by Congress in March, gives hospitals a 20% bonus on their diagnosis-related group paid for by Medicare. Essentially, that means doctors are being paid to list deaths as coronavirus without any indication the patient's death was actually COVID-related.